Hello, I'm Jason Howland, and welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. You know, concussions can be a common thing in sports, especially in professional contact sports, where athletes are bigger and faster. But head injuries and concussions can also happen in local sports with young athletes and also anyone with just normal day-to-day activities. Here to talk more about concussions, our guest today on Speaking of Health is Josh Berndt. He is a Mayo Clinic Health System physical therapist. Josh, thanks for joining us today on Speaking of Health.
Glad to be here. Thanks for having me. Look forward to this interesting discussion we're going to have.
Well, let's start off the discussion by explaining what exactly is a concussion. People have probably heard of it, but a lot of people probably don't know exactly what it is.
Sure. Concussion is classified as a mild traumatic brain injury that typically occurs with a blow to the head, but doesn't have to be a blow to the head. You can also get a concussion with a blow to the chest and have a rapid deceleration or acceleration to the head. And essentially, it's an alteration of the physiologic process that's going on inside the brain, or the brain's ability to function. It's not typically an injury to the skull or the anatomy of the brain that we can see with CTs and MRIs. And so it's more of an altered functioning of the brain that we're dealing with when we talk about concussions. But it is classified as a mild traumatic brain injury.
The brain is a pretty delicate organ, right? And so it probably sometimes doesn't take that large of a blow to do some sort of damage, right?
Yeah, the brain definitely is something that needs to be protected and is pretty fragile. When we're dealing with blows to the head or the chest, there doesn't need to be a loss of consciousness or a severe traumatic event to cause a concussion. And that's kind of one of the misnomers that people have about concussions, is it can be something very simple that happened in Fayette with a kid, or the kid slipped off their bed and fell and just landed on the floor hard. Those types of injuries can lead to concussions as well.
Well, I've heard of the phrase, I had my bell rung. Does that mean that you've had a concussion?
We have seen over the years with the different testing that we've done, is that with a bell ringing phenomenon, you can be impaired with your brain's functional level for up to 4 to 7 days. So most certainly just having your bell rung, seeing stars for that 20 seconds after you got hit in football can definitely lead to a concussion.
Well, what are some of the common signs and symptoms of a possible concussion?
Dizziness, blurred vision, headache, amnesia of the events that happened right before you got hit or right after you got hit, altered personality, numbness, tingling. Any of those neurologic symptoms are indicative of a possible concussion.
So it can be a number of different things. It's not just one specific symptom that says, yes, you've had a concussion. It can be a number of things.
Most definitely. When we're dealing with the brain is responsible for many, many, many things that make us us. And so it can be your personality or your control over an extremity or numbness or tingling, like we said. So it can definitely be a very wide range of symptoms that we're dealing with.
So what should someone do if they think they may have had a concussion?
Well, number one, if they have a coach, if they have athletic trainers, physical therapists, doctors on site, they should notify them that they're not feeling right, that they're worried that they may have got or had a concussion. And then if they're not around, notify their parents and then go see a medical professional.
Do those signs and symptoms that you were talking about, are those for the most part immediate, or can they sometimes happen maybe after the fact?
Yeah, definitely. Sometimes we don't see that occur right after the initial event, but it may be delayed in when they begin to show themselves. So you definitely can see symptoms later on that wasn't really, or that the symptoms weren't very obvious to start with.
So how can we help people that have had concussions? How do you treat a concussion?
Well, first and foremost, it's rest. Removal from that current competition. Do not allow them to go back and finish the game. And then, some people with 1 or 2 days of rest, followed by a graded return to normal activities is all they need. It may be just time. some people struggle to get over that hurdle, and they may need a little more help and guidance as far as returning to normal functional activities, getting back out there and playing again. So it's a very individualized process, and I think that's the main thing that we really have to focus on with concussions, is that each athlete has to be treated as an individual, and there isn't one cookbook that really can suit all of the concussions.
The brain isn't like getting a scrape on your knee where you can put a Band-Aid on it. The brain inside your skull, you can't reach it, so rest, best way to heal it, right?
Yeah, rest, and the thing that we often forget is mental rest is key too. We advocate removing them maybe from school for a day or two so that they're not taking a calculus test the day after, because that's just as taxing on the brain as jogging around the block for a half hour. So kids hate to hear, we want them to take their cell phones away, no video games, remove them from school for a day or two, and just let them rest initially, both with the mental and the physical aspects.
I know for professional sports, like for example the NFL, they have certain rules for concussions on when an athlete can return to the field. Are there things like that for, say, high school athletes, young athletes?
Yes, we essentially follow the same protocol that the NFL system uses. We want them to return to symptom-free activities. They have to pass a neurocognitive test. We use the impact test, which is a neurocognitive test assessing the brain's functional abilities, whether it's memory, reaction, processing, things like that. They have to return to their baseline exam and then return to non-contact drills without symptoms, and then return to contact drills without symptoms, and then we're going to allow them to return to their current sport.
Can you give an example of how the test works and what you do with that test?
Sure. The impact test is the test that we use, and it's a neurocognitive test that we give to all of our athletes prior to their season. So we want to get a baseline level of how their brain processes, how good their memory is, short and long term. We show them shapes, very elaborate shapes. Then we distract them with certain activities with the mouse, and then we ask them, was this one of the shapes that you saw? Yes or no? And it will assess their ability to remember the spatial orientation of the shapes. We have reaction and processing times with mouse clicks to certain colors. They have to count backwards from 25, that will distract them, and then they're asked to recall certain words that they saw. So it's really more of a brain processing test that they take at baseline, and then that's the same test with different shapes, different words, then again that they'll take after an injury, so that we can assess whether or not they return to their baseline level of function.
So are there risks for people or athletes that may return to the field too soon after having a concussion? And what are those risks?
Most definitely. The number one thing that we're trying to prevent is a second injury, and there's a term called second impact syndrome that is a fatal condition that occurs when an athlete goes back to play before their brain has recovered from the first concussion. If they haven't recovered fully, their brain is much more susceptible to a second, more severe injury. There were 40 cases in the last 10 years in the U.S. that led to death after a concussion, where an athlete went back to play too soon. So that's the number one ultimate thing that we're trying to prevent when we're dealing with concussions and return to play. Also, they may have second, third concussions that leave them with permanent brain injury signs and symptoms as well. So things that never do get better. And those are the severe cases that we're really trying to avoid and make sure our athletes are the safest.
Are there ways to avoid concussions, to prevent a concussion from happening?
Number one, is having the right equipment and using the right technique. Coaches can really assist us when they're teaching kids how to tackle or how to check in hockey, that they're not using their head as a weapon. They definitely need properly fitting helmets and pads. Outside of that, concussions do happen. They're part of sport, with kids being faster, stronger, participating in sports at a much younger age. Things are going to happen, and we know that we can't prevent all concussions. But with proper coaching, proper techniques, and proper equipment, we can see concussions reduced.
So Josh, I would think that education is really key for something like concussions, where it's not a visible injury. Education is really important, right?
Yeah, most definitely. We've found through some of the programs that we've instituted within the Mayo Clinic Health System that education is first and foremost when you're starting a program off. We had to reach the coaches, the parents, the kids, and the physicians and the healthcare team that cares for these individuals and make sure everyone's on the same page. They all understand the risks of concussions and the purpose that the program is being instituted for. Once they realize that we're there to protect the kids and ensure their safety in participation with sport, then everyone can be on the same page and really buy into the program. If you just left that portion out, they think that we're trying to prevent their child from playing in the game that can help them to the state tournament, and that's really not the case. We're trying to ensure that they return at the safest level that they can, but yet participate too, because that's what sports is all about. So,
And that's probably one of the most difficult things about a concussion, I would assume, is because it's not a visible injury that a parent may think, Johnny's fine. Look at him. He's doing great. He can go back out on the field or on the court. But sometimes that's not the case.
yeah, exactly. And that was always the trouble with the old system that we try to use, is that they wanted to classify it as a mild or moderate or severe concussion. Was it your first, second, or third? Then you should sit out 1 week or 2 weeks. The CT scans, the MRIs that were taken were normal 97% of the time, because they were assessing for cranial fractures or hemorrhages in the brain, very severe issues. But concussions never showed up on those images. But parents thinking, oh, they took an MRI, it was normal, my kid is fine. It was really hard to convince them. So that's where it's really important that they have a neurocognitive test to assess their brain function before we can let them go back and play. And I often have the parent sit with the child looking over their shoulder during the test, just so that they can see how well they do on the test. And sometimes it's very enlightening for the parent to see, wow, I can't believe that they struggled with that as much as they did, because like you said, you don't notice some of those things in just day-to-day ADLs, such as eating breakfast in the morning.
That has changed a lot in, say, the last 5, 10, 15 years?
Yeah, it's really an evolving science. There's a lot more data now than there ever was before. But I would say about 5 years ago, the Impact software became readily available to all high schools and colleges through their system. There are other programs out there that are in use as well. We happen to go with the Impact software because it's easy for us to use and accessible. But yeah, definitely about the last 5 years, we've seen a lot more attention to concussions and attention to the management of concussions. And we've seen successful outcomes as well. So it's been very exciting to see.
Let's say an athlete may or may not have had a concussion during a sporting event. You said to talk to the trainer or the coach or a parent if they suspect that possibly they have had a concussion. From there, is it a trip to the emergency room, or do they see their doctor the next day, or how does that work?
Sure, that's a great question. You can never be too safe. So when in doubt, definitely I would encourage them to go to the ER. If it was just a bell ringing incident where I saw stars for a little bit and now I'm feeling okay, but I'm a little just, you can feel out of sorts, I don't think that warrants a trip to the ER. But if they're having, lethargy, altered sensation into their limbs, throwing up or vomiting, that's definitely a time where they should go to the ER. But for the most part, if it was just a mild concussion, it's not an emergency, and they can follow up with their family physician the next day. We're lucky because we work very closely with our family doctors, and they support our program very well. They have a very good understanding of what we accomplish with the testing, the Impact software, and then the graded return to play progression that they go through. So that's a very good partnership that we have, and it's definitely a key component to a good program.
So Josh, are there certain people that may be more susceptible to getting a concussion?
Sure. It's interesting you asked that. We see, number one, women or young gals tend to be a little more vulnerable to concussions. And if they have had a concussion, they take a little bit longer time to recover. The other thing is that they found through studies that people have a genetic predisposition to sustain concussions. And so maybe a severe blow to one child did not result in a concussion at all, and then a more mild play in football or a check in hockey results in a concussion that is pretty debilitating to another child. So that, again, I can't reinforce enough how each child has to be managed individually, and each concussion is its own separate event that we have to really manage against their own background data.
Well, thanks, Josh. This is all great information. Hopefully, a lot of parents learned some more about concussions out there, and we can help some of the kids that may be possibly experiencing concussions and don't even know it.
Yeah, no problem. It was my pleasure, and I enjoy talking about this stuff, so feel free to ask any more questions if you need anything.
All right. And thank you for joining us today on Speaking of Health. Have a great day and be healthy.